but certainly not least, Greg Simon. And Greg, if you'll just take a little time introducing yourself, some of your past lives.
I'm Greg Simon. I'm the president of the Biden Cancer Initiative, and last year I was the executive director of the Cancer Moonshot Task Force for Vice President Biden. In 2003, with Mike Milken, I started Faster Cures, and in 2007, with Leon Black and Deborah Black, I helped found the Melanoma Research Alliance. And 20 years ago, I was in the Clinton administration as the chief domestic policy advisor to Al Gore. So I can't seem to get a job. Everything I know about survivorship is probably wrong. I was treated for chronic lymphocytic leukemia 2 years ago, 6 months of chemotherapy. I discovered it through a physical. I was never sick. I never got sick during my treatment, which was a miracle. And I haven't been sick since. But when I left Sloan Kettering, I got no survivorship care plan. I got no discussion about the long-term impact of 6 months of cyclophosphamide and fludarabine and Rituxan. I got no discussion about potential future infections or any idea of how long I would have to keep taking acyclovir and another antibacterial drug. I was just told to do it. Now, because I happen to know a lot of cancer doctors, they volunteered that information to me when I would tell them what I was doing, and they would say, well, you know, you might see this problem or you might see that problem. But that was just because I'm one of those people who knows people who knows people. And that's a lousy network. It's really a lousy network, but it's the only network we have right now. So I know that survivorship has many different faces also. I have a friend who is going through multiple myeloma treatment in Sloan Kettering right now, his second CAR T therapy after a stem cell transplant a year ago. And his wife took their 3 strapping teenage boys on a kite surfing, hiking, camping trip without dad just to prove it could be done, that they could survive if dad doesn't make it. And it was important for them to see that mom could do that because dad was the guy who usually did that. Mom was not the kite surfer. That's a form of survivorship care as well. So I look at the financial toxicity stories that I read about every day. I talk to doctors who put people in hospice who don't want to bankrupt their family to try to survive cancer in the last resort. And I realize we are so far from a survivorship program in this country. And by the time this panel finishes today, your government is going to be voting on whether to take insurance away from 20 to 30 million people. And Donald Trump can say Obamacare is death all he wants. But if you take 20 million people off of insurance, tens of thousands of them will die from preventable, treatable cancers. And that's what keeps me up at night, not the cancers we can't cure. I know there are people working day and night for that. What keeps me up at night is that we might lose people who should be cancer survivors to cancers we can cure, like mine. So we have to start at the top, which is to protect the insurance we've got, and then worry about how we expand that insurance to cover survivorship care programs. I am nowhere near an expert in how a survivorship cancer program should be created, what it should look like, what it should cover, but I do know that there are people you see here who do have that expertise, and that expertise won't matter if we take insurance away from 20 to 30 million people. Now, the idea that was mentioned at the very beginning about the oncology care model, if it's so hard to get an affirmative code to reimburse survivor care programs, then let's just make it a requirement to get paid for treating a cancer patient at all. Let's make sure it's part of the oncology care model going forward. Let's make sure no cancer doctor can treat a patient and get paid for it if they don't have a survivorship care program of some meaningful sort that can help people understand if they're a young woman and they've gotten radiation for a particular cancer, that the odds are they'll get breast cancer before they're 45. And even cancer doctors need to understand that the next disease might be diabetes or high cholesterol with a heart problem and not cancer. But if we don't have those discussions as part of the everyday care, then we are putting people at risk from strict ignorance. My brother-in-law was a strapping 6-foot-something, 200-pound ex-wrestler, great shape, worked out all the time. He did something stupid one day on Catalina Island and almost cut his heel off on the beach. He had 3 surgeries on his heel. My wife had an 18-inch blood clot one point that finally got figured out, and it turned out she has factor V Leiden, which gives you a proclivity to blood clotting. She had her brother tested. He had it too. The doctor sent him home with this huge foot wound, but it is normal practice not to give you blood thinner, even if you have factor V, if you've never had a blood clot, which he had not yet had. But if you were a doctor sending a patient home with a foot injury who has factor V, what would you tell him to be aware of? Well, how about coughing? How about cramps in your ankles? Both of which he ended up having, neither of which he had been told to be aware of. And as a tough guy, he just thought it was part of the deal of being laid up until he died from a double embolism one afternoon in his home. If we can't even get that right and tell people, you need to know that if you start coughing, you go to the hospital, and how are we going to explain to people that we didn't give them any warning that they should be aware of the symptoms of the next cancer? My first sign that I had leukemia was I got a squamous cancer cell on my hand as a result of my immunosuppression from the leukemia, something I happened to be aware of because of my work in the melanoma space. When I saw a new spot, I didn't just blow it off. I knew exactly what to do. So what is the Biden Cancer Initiative going to do about all this? Well, you know, if you study Western Civ in college, you get the impression that everybody does everything at every stage of history, like there was the Dark Ages, and then everybody had a Renaissance. That ain't how it happened. There were 100 people that made the Renaissance. Of all of the people in Europe, there were 100 people whose work defined the Renaissance. So it's part of our job to find the 100 people, and let's start with the ones who run the cancer centers, to be the Renaissance in survivorship, as well as the other issues we're taking on, like data sharing, patient-centered clinical trials, access to the right medicine and the right trials and affordable prices wherever you live. We need to find that group of 100 who can change the assumptions about what it means to take care of people. You know, cancer centers will spend literally hundreds of millions of dollars to get certified as a cancer center by the NCI so they can get millions and millions of dollars of grants. And yet we know that cancer centers don't all have smoking prevention programs, and they sure don't all have survivorship cancer programs that are meaningfully impacting patients today. And let me end on this one point. And you may think this is a little crazy, but it's you know, somebody once said, why do dogs bark at postal workers? Well, it's because the post office guy is the only person who comes to your door every day you don't let in. And dogs figure out you don't like them. Everybody else comes in. And so they bark at the guy walking to the door that you don't let in. So let me ask you this. Why is it that life insurance salesmen come to your house, financial planners come to your house, and doctors don't? It's because life insurance people want to see your life. They want to see the pictures of your family on the piano or on the bookshelf. Financial planners want to see your lifestyle. See if you're a hoarder. See if you're laid up. The life insurance people want to be able to look around and make sure you value all the things in your house you're going to leave behind and you don't leave your family in debt. And yet, when we're talking to people about surviving cancer, we do it most of the time in the most hostile, unfriendly environment they've experienced, which is a hospital or a doctor's office. And we wonder why they don't remember anything you tell them. People remember something better in the environment where they learned it. That's why they used to say, if you studied in college when you were stoned, you might as well get stoned for the test, because that's how you learned it. I'm not making that up. And when we wonder why people don't hear you when you have a cancer diagnosis in the doctor's office, it's because they're already freaked out to be in the doctor's office. And when you have your exit interview in the doctor's office, just getting out of the building is what's on your mind and not ever going back. So yes, it would be a much better thing if we talked about survivorship issues in your living room. Maybe even at the same time we're talking to you about your life insurance or your financial planning, because that's when you're open to it. We're so far from there. And if it's a question of money, we know we have the money. What we don't have is the will and the culture of doing things that way. So at the Biden Cancer Initiative, it's our hope that we can find the levers to change the expectations and assumptions that keep us from treating cancer survivors with the same intensity we do when they get diagnosed, and to give them some way to know how to take care of themselves by recognizing the early signs of something that's the result of their chemo or their surgery or all the radiation or all the other injustices we put on cancer patients to cure them. And the stories I've read that are the most effective are ones where it's not just doctors, but nurses, social workers, financial people who can help you figure out the problem, because we all are more than just a cancer patient. We all are more than just a series of symptoms. We live a holistic life, and we need people who understand how my divorce as a result of the cancer may affect my survivorship, how I deal with my children, how they deal with me, how they go camping with mom and not make me feel like I'm already dead. Those are things that doctors aren't good at, but there are people who are really good at it, and we need to be including them in what we're doing to help people survive cancer. I can tell you that every cancer patient's goal is to be even in a bad survivor program, because it means you got there. And as somebody who didn't even think about a survivorship program when I left my last chemotherapy, but who now wonders how my life expectancy has changed, how my future health will be changed, I wonder how people without my insurance and without my friends get there. And the answer is thousands of them, maybe millions of them, don't get there. And that's what we're all trying to solve. And if there's any one thing Vice President Biden has put front and center, it's that we have to have a sense of urgency, and we have to change our culture. We have to change our expectations and the normal way of doing things, because that's not working. We need to start with fighting for our insurance and then start fighting for our humanity. If we can't even pay doctors to talk to you about your end-of-life care, it's really hard to get them to sit down and talk to you about surviving something when they think they've already survived you, so to speak. We have a lot of work to do, but we are all in this together, and I think we can get there, but it's going to be hard. Thank you very much.